Imagine you're chasing prey, your heart pounding with the rhythm of the hunt. The ground is a blur of rock and root. Suddenly, your foot snags. You hear the snap before you feel it. A sickening crack that echoes in the sudden silence. Your leg is bent at an angle it should never be. There's no hospital, no X-ray, no 911. For a prehistoric human, this looks like a death sentence. Or was it? The bones of our ancestors tell a very different and far more surprising story. Let's not understate this. For a hunter-gatherer whose very life depends on mobility, a broken leg is a catastrophe. The immediate dangers are overwhelming. Shock can set in. If the bone pierces the skin, an open fracture, there's a serious risk of blood loss and infection in a world without antibiotics. Even if you survive the first few hours, the long-term prospects seem just as grim. A broken leg means you can't walk. You can't hunt, gather water, help carry children, or flee from a predator. In the harsh logic of survival, a single immobile person could become an anchor, dragging down an entire group that needs to follow migrating herds. For decades, a common assumption was that such an individual would have been left behind. It's a brutal thought, but it was often seen as a necessary sacrifice. This was framed as the cold, hard law of nature, survival of the fittest. But it turns out, this assumption might have been deeply wrong. And yet, the ground keeps handing us skeletons that tell a different story. Archaeologists digging into the deep past, from the caves of Europe to the rainforests of Asia, kept finding a puzzle that defied this cold logic. They found bones, femurs, tibias, arms, and skulls that had been shattered and then, impossibly, had healed. These weren't minor cracks. These were catastrophic breaks that would have left an individual utterly helpless for weeks or even months. The bones themselves are a testament to this. A healed fracture leaves a distinctive mark, often a bony lump called a callus, showing where the body's incredible repair mechanisms knitted the pieces back together. A bone that healed poorly tells a story of survival through immense pain. But a bone that healed well hints at something even more profound. This presented a paradox. If a broken bone was supposed to be a death sentence, why did so many of our ancestors seem to survive them? How could someone who couldn't walk, hunt, or even stand live long enough for a femur to mend? A process that takes months of rest even today? The answer isn't in a new tool, but in a revolutionary idea about the very nature of humanity. In the Zagros Mountains of modern-day Iraq, inside a place known as Shanidar Cave, researchers in the 1950s found the remains of a Neanderthal who would change our understanding of prehistory forever. He is known as Shanidar I. He didn't just survive a broken bone. He survived, well, pretty much everything. Analysis of his skeleton shows that early in his life, he suffered a crushing blow to the left side of his head. It fractured his eye socket, likely leaving him partially or completely blind in that eye. The same injury probably caused brain damage that withered his right arm, rendering it useless. Evidence on the bone is consistent with the arm having been amputated at the elbow. On top of all that, he had a healed fracture on a foot bone that would have caused a painful limp, and bony growths in his ear canals suggest he was also profoundly deaf. Under a simplistic survival of the fittest model, Shanidar I is an anomaly. He was likely half-blind, deaf, had the use of only one arm, and walked with a painful limp. He couldn't have hunted effectively. He couldn't have easily defended himself from the predators that roamed the landscape. By all pragmatic measures, he would have been a burden. And yet, he didn't die from his injuries. He lived to be between 35 and 45 years old, a ripe old age for a Neanderthal. He lived for decades after his initial, crippling trauma. The strong inference here is that this is impossible without one crucial element: constant, dedicated, long-term care. Someone had to have fed him, guided him, and protected him. Shanidar I isn't just a story of one individual's toughness. He is the fossilized evidence of his community's compassion. For a while, Shanidar I was seen as a remarkable, perhaps isolated, example. But it wasn't an anomaly. In 2022, a discovery in a remote cave in Borneo, Indonesia, pushed the timeline for this kind of care back even further. In Liang Tebo cave, archaeologists uncovered the 31,000-year-old skeleton of a young adult. The skeleton was mostly complete, but the lower left leg was missing. On closer inspection, the researchers found something astounding. The remaining leg bones, the tibia and fibula, weren't shattered. They showed clean, healed surfaces, indicating the lower leg had been deliberately and skillfully amputated. This wasn't an accident. It was surgery. 31,000 years ago, someone in this group had enough knowledge to perform an amputation and prevent fatal bleeding and infection. Even more remarkably, the bone showed signs of healing for 6 to 9 years after the procedure. This young hunter-gatherer lived on for nearly a decade in rugged rainforest terrain without their lower leg. This discovery is a bombshell. The inferred surgical competence suggests that advanced medical care existed tens of thousands of years before the rise of agriculture. From the 530,000-year-old skull of a disabled child found in Spain's Atapuerca Mountains, whose survival to age 10 is also interpreted as evidence of social care, the evidence is overwhelming. Our ancestors didn't just survive their injuries, they were cared for. So how did they do it? The solutions were likely born from observation and necessity. The core principle of treating a fracture is immobilization. While they had no plaster, it's plausible our ancestors developed splints from wood, bark, or reeds, binding them with leather or plant fibers. This technique is so fundamental that it was developed by cultures all over the world. It's a reasonable hypothesis that some healers became specialists, passing down their knowledge. They may have learned to set bones by applying traction to pull them into alignment before swelling got too severe. This suggests a practical, if not academic, understanding of anatomy. They also likely had a basic pharmacy of pain-relieving and anti-inflammatory plants. But splints and herbs are useless if the patient is left alone. The real medicine was the community. Caregivers had to provide food and water and keep the injured person safe. This wasn't a short-term commitment. Healing a major fracture meant the group had to slow down, adapt, and dedicate resources to someone who wasn't actively contributing. It required a social structure built on something more than pure utility. This brings us to the most important question. Why would they bother? In a world of scarcity and danger, why invest so much in caring for the injured? The answer challenges the old, simplistic narrative of survival of the fittest and suggests a more powerful and more human idea. Survival of the kindest. Caring for an injured member wasn't a liability. It was an investment in the social fabric of the group. When a community cares for one of its own, it sends a powerful message to everyone. You are valuable beyond your ability to hunt. Your knowledge and experience matter. You won't be abandoned if you fall. This fosters trust and deepens cooperation, which are the ultimate human superpowers. In evolutionary terms, prosocial behaviors that strengthen the group can be a winning strategy. The people being cared for were often elders who held a lifetime of knowledge. Keeping them alive meant preserving the group's collective wisdom. Shanidar I, for all his disabilities, was an elder. His survival meant his experience wasn't lost. In this light, compassion wasn't a weakness. It was a survival strategy. What aspect of ancient survival psychology surprised you the most? Is it the skill of the healers or the compassion of the community? Let us know in the comments below. And if you're enjoying this journey into our deep past, please subscribe for more stories that rewrite our history. There's a famous story, often attributed to the anthropologist Margaret Mead, that the first sign of civilization was not a clay pot or a tool, but a 15,000-year-old healed femur. While the quote itself may be more of a legend, the idea behind it is profound. In the wild, a severe broken leg is often fatal. An animal can't easily flee danger, get water, or hunt. While some animals do survive such injuries, it's incredibly difficult. A healed human femur is evidence that someone else stopped. Someone stayed with the one who fell, bound the wound, and tended to them through a long recovery. It proves that at some point, we chose not to leave our wounded behind. We chose to help. That single act is what can separate us from the raw indifference of nature. It's the genesis of community, some of the first fossilized evidence of empathy. It tells us that long before we built cities or wrote laws, we understood that our greatest strength wasn't our individual toughness, but our willingness to carry each other. Every ancient bone that mended is a message. In the only language that outlasts everything, somebody stayed. Survival wasn't just about being the strongest. It was about being connected. And perhaps that's the most important lesson our ancestors have left for us.